All right, so this will be the third type of anemia that I'll be focusing on today. And the name of this is what? Sideroblastic anemia. Right, so we'll be talking about sideroblastic anemia, we'll be talking about the definition, we'll be talking about the causes, the symptoms, the diagnosis, treatment, the types of sideroblastic anemia, and finally we'll be talking about the prognosis. All right, so sideroblastic anemia is quite an interesting topic, and I know you guys will enjoy it. All right. So, what is our focus? To discuss sideroblastic anemia. All right. So, moving into the sideroblastic anemia, let's talk about the definition. We said that sideroblastic anemia is a rare type of anemia characterized by inability of the bone marrow to produce hemoglobin. All right. So, if hemoglobin is not produced, it will lead to what? Inadequate red blood cell production. Right? So hemoglobin is not produced, and hemoglobin is needed for what? Red blood cell production. So if hemoglobin is not produced, then um, inadequate red blood cell production, and also you know that hemoglobin is a carrier or the transporter of oxygen. So both uh, pathways are affected, right? So what are the basic causes of sideroblastic anemia? We have genetic causes, we have genetic or acquired causes. All right, and this is basically defects in hemoglobin synthesis. All right, so if there's genetic cause, there's an acquired cause, it will all lead to what? Defects in the hemoglobin synthesis. It will lead to defects in hemoglobin synthesis, mitochondrial dysfunction, or inherited disorders like what? X-linked sideroblastic anemia. Okay, so what are the symptoms of this medical condition? Generally, the individual will be weak because there's no much blood cells, there's no much oxygen. Fatigue, weakness. I think fatigue and weakness, I find them like the same concept though. Fatigue, weakness, pale skin, shortness of breath, dizziness, and enlarged spleen. Okay. Then what are the diagnoses? Diagnosis basically you do blood tests like complete blood count, peripheral smear, bone marrow biopsy, and genetic testing. Okay, to basically confirm that okay this individual has a sideroblastic anemia. Then what are the possible treatments for this medical condition? You could do a blood transfusion, you could do ion chelation therapy, you could do vitamin supplements like folic acid and pyridoxine, okay? And in some cases, you can even do a replacement of the bone marrow to basically boost up red blood cell production. What are the types of sideroblastic anemia? We have the X-linked sideroblastic anemia, which is the most common inherited form. We have the autosomal recessive sideroblastic anemia, that one too is still inherited. Then we have the acquired sideroblastic anemia, which is associated with what? Myelodysplastic syndrome and myeloproliferative neoplasms or other bone marrow disorders, right? So basically, a summary of this is sideroblastic anemia is a disease condition or blood disorder that you can actually get on later in life. Okay, you can get it later on in life, or you can get it like how will I put it? You can get it as you can get it on the go. Okay, so you can get it later on in life, or you can be giving birth to with it. Okay, that's the genetic. All right, and genetic can be X-linked or autosomal recessive. Right. So these are the various symptoms of sideroblastic anemia. Have we spoken about the symptoms? Yeah, we spoke about the symptoms: fatigue, weakness, paleness in skin, shortness of breath, dizziness, and enlarged spleen. Let me see what we got here. Jaundice, bronze, colored or pale skin, same thing. Fatigue and lack of energy, same thing. Headaches, headaches was not there. Lightheadedness or dizziness, difficulty in concentration, and abdominal distension. So moving on to the prognosis, we said that prognosis varies depending on the underlying cause and severity. Some cases of sideroblastic anemia may be progressive, okay, up to the level of severe anemia, and you could also have heart problems or leukemia. Sideroblastic anemia is a complex condition requiring medical attention and ongoing management. Ongoing medical management, okay, in order to alleviate the symptoms and prevent complications of what? Sideroblastic anemia, right? So that's it about the sideroblastic anemia, basically talking about definition, causes, symptoms, diagnosis, treatment, types, and prognosis. Okay, so that's it. We'll be moving on to the next one. Bye for now.